So a Brazilian butt augmentation is when you place fat into the buttock in order to shape and project the buttock in an aesthetic fashion. It is a procedure that can be safe in trained hands. Inherently, all surgeries do have risks, but if you inject the fat between the skin and the muscle, it is a safe procedure. People that are best candidates for BBL have a little bit of extra cushioning that can be taken down and transferred into the buttock region. Liposuction is a tool that's best used in a patient that can be shaped and sculpted like a bar of soap. If there's not much to be taken away or added somewhere, they're really not a great candidate for that. Brazilian butt augmentation is a procedure that can be safe in a trained set of hands. In order to be safe, you need to place the fat in between the skin and the muscle. In studies that we have done through plastic surgery, we found that there has been no incidence of fat embolism when the fat is placed in that plane. That being said, if you do place the fat in a deeper plane, there is a risk of fat embolism into the lung, which can stop bleeding. The incidence of this case is about 1 in 3,000. In all the studies that were done, these cases, the fat was placed underneath or into the muscle itself, leading to these issues. Technically, you could. In my hands, I typically like my patients asleep under full anesthesia care so they're comfortable. The way I inject my fat, it's on something called a micro-air device, and it's reverse pumped through this micro-air device. The cannula itself is about 4 millimeters in diameter, and that would probably not feel very good awake, so you probably want to be asleep for that. The reason the cannula is so large is in order to stay in the safe space between the skin and the muscle, cannulas need to be large enough so they don't flex into the wrong space, thus leading to fat embolism. By using a larger cannula and putting on the power, you can always feel the tip and stay in a safe space as you're injecting the fat. The procedure itself, the fat grafting, really takes approximately 45 minutes. At that point, you're actually using your hands to feel the tip of the injecting cannula to make sure you're in a safe space. And you have to be extremely careful when you're doing the fat injection. The bulk of the procedure is actually when you're performing liposuction and sculpting the waist, the hips, the back in order to really project the buttock. Even without grafting fat into the buttock region, you should be enhancing the buttock by taking down the waist and hip fat to highlight the patient's natural curves. If you don't have any fat to transfer in the buttock region, there are options such as Sculptra, where we inject this material into the buttock region, increasing collagen production. That being said, it's not a huge change, but if you're looking for something, that is one of the options. Additionally, there's another product called Renuva, which is off-the-shelf fat. Unfortunately, it's extremely expensive in a cosmetic setting, and it might be cost prohibitive to transfer fat, as only 1/2 of the fat that we transfer actually stays. And typically, on average, I'm augmenting approximately 800 cc's of fat to each side, leading to approximately 400 cc's of viable fat long term. After BBL, typically your final result is visualized about 3 months after surgery. The fat is placed. When I place it, I inject it from a top-down fashion in order to avoid deeper planes that are not safe. When you place it, it's kind of artistic because you're basically spray painting the fat into the area, so you really need to draw the planning with the patient standing for your target regions and then place the fat in a aesthetic or artistic fashion, working from the mid-buttock lateral area, also known as the hip dip, working in to project the posterior portion of the buttock, working in the posterior thigh to support the larger buttock mound. Oftentimes, if you don't inject in the lower posterior thigh, you end up with a very large buttock and not enough lower leg to support it. It's not a good look. The recovery process is a bit of a drag. The recovery process consists of wearing foam padding for 1 month with a compression garment, followed by wearing a compression garment for another month. The foam is to help provide equal pressure to all areas that have been liposuctioned. The analogy I typically give to my patients is that when you're post-liposuction, the wound sites are such that they're akin to a wet sponge. You want the wet sponge to dry flat, such as when you put a book on a wet sponge that dries very flat in a new shape. The liposuction foam and the compression garment together provide that compression, leading to a superior result. After BBL, it's best to go ahead and use something called a hamstring pillow or BBL pillow. It is a device where you sit on it with the back of your thighs and your butt kind of floats in the air and your back rests on a regular chair so that no pressure is placed on your butt. Ideally, sleep on your belly after BBL in order to offload the pressure. That being said, you really don't know what you're doing at night. You got to sleep, so just try to avoid pressure on it for about 6 weeks.